This video is for educational purposes only and does not replace advice from your healthcare professional. Always consult your doctor or pharmacist with questions about your medication. Can you freeze semaglutide? If you're using Ozempic or Wegovy, this is a question you need to know the answer to, and that answer is a clear no. If your semaglutide has been frozen, even accidentally, you need to discard it and get a replacement. There's no way around this, and here's why it matters. Semaglutide is what's called a peptide-based medication. Think of it as a carefully structured protein molecule. Unlike some other medications, these protein structures are incredibly sensitive to temperature extremes. When semaglutide freezes, ice crystals form in the liquid, and those crystals physically damage the medication's three-dimensional structure. Imagine a carefully folded piece of origami. Once you crumple it up, you can't unfold it back to its original shape. That's essentially what happens to semaglutide when it freezes. The damage is permanent, and it can't be reversed. The FDA-approved prescribing information for both Ozempic and Wegovy is explicit about this. Frozen semaglutide must be thrown away. This isn't a suggestion, it's a safety requirement based on how the medication works at a molecular level. So what's the actual problem with using frozen medication? Well, once that structure is damaged, the medication can't work the way it's supposed to. If you're using it for type 2 diabetes, you might not get adequate blood sugar control. If you're using it for weight management, your treatment might not be effective. And in some cases, damaged medication could potentially cause unexpected side effects. Here's what makes this tricky. Frozen and thawed semaglutide might still look completely clear and normal. You can't always tell just by looking at it that the medication has been compromised. That's exactly why the storage guidelines are so strict and why you should never take chances. Let's talk about how to store your medication properly. Before you use your pen for the first time, keep it refrigerated between 36 and 46 degrees Fahrenheit. Don't put it in the freezer compartment and keep it away from the back of the refrigerator where temperatures can drop too low. Once you've started using your pen, you have some flexibility. You can keep it refrigerated or you can store it at room temperature up to 86 degrees. The exact time frame for room temperature storage depends on your specific product, so check your FDA-approved prescribing information or ask your pharmacist for details. Quick note, if you're taking oral semaglutide, the brand name Rybelsus, those tablets don't need refrigeration at all. They have completely different storage requirements. Now, if you use compounded semaglutide, which is not FDA approved, follow your compounding pharmacy's specific storage instructions and contact them directly with any storage concerns. What about traveling or power outages? These are real situations where your medication might be at risk. If you're concerned about temperature changes or possible freezing during travel or a power outage, contact your pharmacist or healthcare provider right away. They can give you product-specific guidance and help you determine if your medication needs to be replaced. Before every injection, inspect your medication through the viewing window of your pen. The solution should be clear and colorless. If you see particles floating in it, if it looks cloudy, or if there's any discoloration, don't use it. These are signs the medication may have been damaged. And even if everything looks perfectly fine, if you know or suspect your semaglutide has been frozen, don't use it. Contact your pharmacy or healthcare provider to get a replacement. If you accidentally use medication that may have been compromised, reach out to your doctor. They can help you monitor for any issues and adjust your treatment plan if needed. Watch for signs like blood sugar levels that aren't as well controlled as before or changes in how the medication affects you. Let me recap the key points. Never freeze semaglutide and always discard any medication that has been frozen. Keep unopened pens refrigerated between 36 and 46 degrees. Once you start using a pen, follow your product's specific FDA labeling for storage options, and always inspect your medication before each use. If you have any questions about storing your semaglutide, or if you're not sure whether your medication has been stored properly, talk to your healthcare provider or pharmacist. They can give you personalized guidance based on your specific situation and product. Remember, this information is educational and doesn't replace professional medical advice. Always consult your healthcare team with questions about your treatment. What storage challenges have you faced with your medication? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.